On today's episode, we will be speaking with Dr. Evita Limon-Rocha, who is a Latina Spanish-speaking dually board-certified psychiatrist specializing in child, adolescent, and adult psychiatry. Her ultimate goal is to decrease stigma around the utilization of mental health services and mental health diagnosis, specifically within underserved communities, the Inland Empire, and the Latino community. So join me, friends, in welcoming Dr. Evita Limon-Rocha. Welcome to the Becoming Latina Physicians podcast, a place where I share my journey to becoming a physician, as well as the stories of others in our community to help inspire, mentor, and equip current and future Latinas on their successful journey into medicine. I'm your host, Dr. Alanis, a board-certified diagnostic and interventional radiologist. Join me in our trailblazing community as we share stories, inspire, and mentor each other to thrive in medicine. Get ready to learn, grow, and become resilient, friends.
I am Doctora Evita Limon-Rocha. I am a child, adolescent, and adult psychiatrist practicing in the Inland Empire, my beloved home. And so it's a pleasure to hopefully to reach lots of individuals and have them consider psychiatry something that I really didn't know a whole lot about, even through most of medical school. I didn't really know a whole lot about psychiatry or mental health. So that's why I'm really excited to talk about it.
I agree. Just for recap, Evita and I, we both participated or went to the same program in medical school. It was called UCLA Prime. Now it's Prime LA. And I was also part of the Charles R. Drew University science component of that. And you were part of the
UCR. I got to be at UCR. So Highlander.
That's right. But we were all under the same umbrella, basically. And so that's where our journey started together. And I can tell you that even then, like going through a rotation, I don't remember seeing or the advertisement or like people saying that psychiatry was a popular rotation to go through. But how did you know or find out that's the path that you wanted? Because I know I took a roundabout way to get to where I am today.
So it kind of happened the universe, to be quite honest. And I asked students to check out The Alchemist because I really feel that the universe is always trying to guide you in the direction you're meant to be. For me, the only thing that I ever really knew was family medicine or pediatrics. I didn't really know any other specialty within medicine, partly because there was a good chunk of my childhood that we didn't have health insurance. But when we did, those were the only really specialties that I knew of. And so for me, being Latina, and I knew that I had a love of science and I would see just kind of the hand move and the tendons and the muscles. And I always thought that was the coolest thing ever in terms of your brain, and you could move your body and not say anything, and just the amazingness of the human body. So it's always a science nerd. Big Miss Frizzle fan of kind of the magic of learning in that adventure and that journey. And she had the coolest outfits, the planetarium or the stomach or wherever she was going. She made learning fun. And for me, growing up, a lot of my family on my dad's side were Spanish speakers. And so they knew that I loved science. And early on, I wanted to be a pediatrician. And being the kind of the oldest of four, I wanted to be a pediatrician. Didn't know that they were teaching me things, but they would tell me about their experiences with doctors. They would tell me about their experiences with the healthcare system. And they didn't realize they were teaching me all the things that I didn't want to be part of, and I wanted to be better. They would tell me, ese doctor me dijo esto, that doctor told me this, or they would tell me how they didn't understand what the heck the doctor said because they didn't have a translator. And so they would kind of tell me that they were lost, or the doctor would tell them to change their diet in a way that wasn't very culturally respectful. They would tell me just their frustrations, but were teaching me that I wanted to be more than a pediatrician at that point, because I realized that as a Latina, you want to make an impact on one person, you have to make an impact on the family. And so that being said, that kind of led me in the journey of wanting to be a family medicine doctor, because I grew up with a lot of individuals with diabetes. And so I said, okay, can't have one eating las papitas. You can't have one person eating the chips. We got to kind of all do this together for it to be meaningful change. really, that was my journey of where I was going in terms of medical school, because I didn't know a whole lot. I was figuring things out kind of as I went. Someone doing something, then I was like, okay, that sounds like a good idea. I'm going to follow that too. And they joined the kind of this honor society. I'm doing that too, because that looks like going to be on my journey to medicine. Interestingly enough, that when I was graduating college, I had a family member that had, and we as a family had a very negative experience with the mental health field. And it's very traumatizing, to be quite honest. Distinctly remember graduating from college and that family member, they were so sleepy on the medicines that they were on, they were barely able to stand. And I distinctly remember thinking psychiatrists are mean, horrible people. And I and my family all had a very negative experience with the mental health system at that point in time, and actually for years. And so that was the one thing, if you would have asked me at the beginning of medical school, that would have been like the considering never, ever, never want to be a psychiatrist. And so I really went through medical school kind of loving all aspects of medicine. There was a brief period that I wanted to be a neurologist. I even looked at how to become a neurologist and the match process. So I jumped around from different specialty, thinking, yeah, psychiatry is the one I've already crossed off, but not considering because they're mean, evil people. Luck will have it that in my third year of medical school, I rotated through psychiatry and I saw some patients and families transformed with the right psychiatric medicines. I saw and met some really compassionate, caring, wonderful psychiatrists, and it was very jarring because I was like, wait a minute, I had this whole picture for years of these doctors being uncaring, like really just not wanting to talk to their families or patients. But then as a medical student, rotating through the VA, and I'm seeing these really wonderful, amazing doctors that are going above and beyond, that are really spending a lot of time with the families, that are really spending a lot of time with their patients, and didn't know what to do with that information. But lucky for me, I was primed, just like you, which I was super grateful for, because then it allowed me that MPH year to figure out sense of, because I was really lost. After that, I don't know what to do. Trip mine, that family medicine, and then after that, everything, but then back to family medicine was where my home was going to be. I had this rotation and it was like, whoa, I don't know what to make of this information. And my one thing with this, and one of the reasons why was really grateful to be part of this podcast, is that I didn't have very good mentors. I didn't have people that could help me explore what it meant to be a psychiatrist. Some bad advice that I wasn't weird enough to be a psychiatrist. And the feedback that I got didn't really help me make sense of kind of the information that I was gathering and that experience of that psychiatry rotation. I took the MPH year to explore through kind of policy and really understand the challenges that many patients face, kind of psychiatric help and increase kind of just really affecting life and how long people lived if they had a kind of we call it severe mental illness. And that really kind of took me aback as well, because that made me angry, because I live this with my family, the bad things that can happen. And then I'm seeing this kind of across the nation, that my family weren't the only ones. There are a lot of individuals that are struggling to just get help, or just kind of in terms of the impact on life and life expectancy. That was a psychiatrist, to be quite honest. Like I had no, like within psychiatry to talk to. So then I was like, okay, well then the route that I've been wanting to go to this entire journey was family medicine. So I'll go with that, because I didn't know where else. I was like, I hadn't done any rotations in psychiatry beyond what I was required to do. And I went the safe route, and for me at that point was, and so I matched, but when I matched, the universe helped me realize shortly afterwards that wasn't the direction. And I knew pretty quick on that wasn't the direction that I was supposed to be in. And so shortly after that, I started really trying to explore what the universe was telling me, in that I had gone the wrong way. And one of the things that I tell students is mentorship is key, really seeking out individuals to help you. And at that point in time, my program director for my family medicine program. Amazing individual. He really had some tough discussions with me early on and was very supportive of me trying to figure out what I was trying to do with my life and what I was trying to do in terms of my mission as a human being on this planet. And so he was a really amazing individual, and I'm very grateful to Dr. De Leon because he definitely, I can't imagine what it was like to be a program director in a relatively new residency program and have this very lost intern that's trying to explore what they want to do, and incredibly supportive, incredibly wonderful. Ultimately, after trying to help that family member seek psychiatric admission and being really frustrated with the system, I said, Evita, you have to be an advocate. You know what it's like to be frustrated and angry at the system. You want to be an agent of change and the world, and you're meant to be a psychiatrist. And so I jumped to psychiatry, and I'm very grateful for that. And definitely encourage students and scholars to have those informational interviews, to really ask and feel free to ask, hey, what is it like to be a psychiatrist? And I take every opportunity that I have to talk to students so that they consider psychiatry and they have an opportunity to learn about psychiatry. Because I think the other thing too is that it breaks my heart that the numbers, right, in terms of the U.S. physician workforce being 2.4% Latina, 6% of the U.S. physician workforce being Latino, and in terms of Spanish-speaking Latina psychiatrists, there's not very many of us. Dr. Lobliner is kind of, I can count on my hand the amount of Latina Spanish-speaking psychiatrists that I know, and we know that it's very hard. It's a very hard topic, and they're very challenging conversations that I have with families, but it's a very beautiful field. And so it's very important that students have and consider it. Because it's just important work, and we need students to really think about being a psychiatrist or a child psychiatrist for our communities, to be our own mental health superheroes for nuestra comunidad, our community.
Saying to your story, and I'm so invested just thinking about all these questions I have for you. Did you mention that you're the first to go to college and medical school?
In terms of medical school, my mom actually went to UCR. So I wasn't the first to go to college. I think even so, information that my mom was able to provide was he didn't know how to kind of advise me in terms of the field of medicine. And I think she was a little heartbroken by her own path. And I think that prevented her from really being able to advise me. She was on the path of wanting to be an attorney and financially wasn't able to pursue that dream. And so, so she got into law school, but it didn't finish law school because of financial reasons. And I think that really, in terms of her ability to advise me, impacted. And I really think that she just didn't know, like she knew that she did everything that she could to support me on my journey. But I think her ability to kind of give me the skills, she supported all of the reading and the clubs and the speech and debate and kind of moved mountains. I think she did an interdistrict transfer so I could be at a better high school. So she did a lot to help, but she definitely didn't know how to advise me of the preparation, or I don't think she even, I think, knew really about the study prep, even with like, in terms of standardized tests. She knew it would be helpful, but I don't think she knew that there's these prep courses or kind of these things that you can do to help. And so I don't think she could advise me in a lot of challenges that I faced, even though my mom went to UCR and graduated from college. Even so, financially, and I think overall, I feel like I definitely connect with a lot of first generation individuals because how I felt like in terms of the roadmap, it was pioneering kind of one way and kind of figuring it out in the moment.
Does your mom ever say or talk about mentors? Did she have any?
My grandfather actually went to, I think, first and second grade in the Imperial Valley. He went to a segregated school. He didn't go very far because it was time to work and he needed to help his family. And so off to the fields he went. as a little boy here in California. And I always say in California because I've been asked before, oh, that was in a different place. I'm like, no, in the state of California. My grandfather, attended a segregated school and didn't get very far in school. And my grandmother didn't go to any school. I remember as I grew up, her dream was to write her name. And so I remember that was like the biggest dream, that she was like going to write her name. And she did. I think it took her until she was 65, but she finally could write her. And that was her biggest dream. Didn't have any education, and she's going strong. She just turned 93 not too long ago.
Wow. That's awesome. I love hearing your story because I know that it's going to help. It's going to help someone. Someone's going to hear this podcast, this episode, and be like, okay, I see Dr. Evita. I can be like Dr. Evita. I have a similar background, upbringing. And, it kind of gives me goosebumps in a way, because I see how, even though we've come so far compared to our parents or grandparents, we still need guidance. We still need mentors. We still need someone to kind of tell us, you can do it. You are capable. You're more than capable, even if certain doors get shut because of financial reasons, or just because you don't know exactly what you're doing, or actually people will tell you, maybe you should look into something else because I don't think you're smart enough. I don't think you have the ability to complete this or pursue this career. I was told in the past a lot of times, nope, that's not going to be you. You don't have the grades. You don't have this. But so thank you for sharing that, because I know that is a very personal story, but also I feel like it's important to share. And then the other question I had for you was, when you were in your training for psychiatry, and even as a culture, the Latino, Latina, Latinx culture, Hispanic culture, I know that you had exposure to it, but there's always that taboo of you can't really express yourself if you're depressed or you are not feeling well, or there's some kind of mental limitation. Sometimes people in your own culture, in your own family, will say, oh, you're just making it up. You're just lazy. They don't understand this disease. Can you talk a little bit about that in your experience and when you work with the Latino culture?
So one of the things that I talk to students, I always dress in a certain way, and I bring little things that are very me, because over time I learned that it's important that we bring all the wonderful aspects of ourselves to our patients. It's very meaningful to them. And so today I wore hot pink. That's my favorite color. And I'm wearing kind of this like Mexican embroidered dress, actually. And the reason why I mention that, and the reason why I'm always very intentional with how I dress, is because it was a process to be comfortable in my own skin. And there was a point in medical school where I tried to be what I thought the version of fitting in would be. So I remember this black backpack that I had with the pink inside, but it was like no one could see that except for me. And my sparkly little badge, like I did not have that, because I definitely wanted to be a serious medical student. So kind of cultural things I wasn't kind of wearing. But over time, it's very much any single time I do any sort of speaking engagement, there's something there that I bring my culture, I bring my heritage, I bring who I am, so that everybody can see. And that's really, really important, going back to your question, in that these conversations of helping individuals understand of thoughts, beliefs that impact their ability to seek the help that they need. Being Latina of Mexican roots, I always kind of came in from a framework, my familia, my family. And so, but now as I've been practicing, I realize that almost every single person that comes into the office and talks to me struggles to understand what is this depression that I can't see like a lab test. That there's no brain imaging that I can necessarily kind of point and say, this is depression, or this is anxiety, or this is ADHD. And it's really hard. And especially as I work a lot with kids and teens, it's hard for parents and loved ones to really wrap their minds around, they're not being flux, they're not being lazy. It's the depression has just robbed their child of energy, of motivation, of their want to go to school, of their want to shower, to brush their teeth, to interact with the family or do the things that they love, and really helping them understand that they're not being kind of rude in a way that they're just kind of not completing their chores. It's really that this diagnosis that they can't see, like in terms of a lab test or other things that we can see, like, oh, their blood sugar is up. It's harder for them to understand. And so it's really powerful that when I'm in the room with patients, especially from patients, to help in their own language navigate kind of what this means and bring some humanity. And I come in as a doctor, but also as a parent. I have 3 children. My son has ADHD, and I frequently will tell my parents that it is hard in terms of kind of, yes, I'm going to use to start a lesson. I really try to kind of empathize with my families, try to, one, help them be well informed and really navigate culturally they may have challenges with or kind of fears that they may have, because a lot of times my parents that are struggling, they themselves can easily recognize, oh yeah, I was in trouble, I couldn't sit still, or they may have had a negative experience. And my hope is always when I have my families in the room that this is a positive experience. They leave the room and say, you know what, no one forced any sort of treatment on me. It's left me well informed. And I think one thing too is that I'm Latina. My dad is from Mexico. But at the same time, that doesn't mean that I'm an expert. But what it means to be Latina, it means that I have my own understanding, but I'm always very curious to learn how all the different aspects of the experiences of my families and how that is all occurring at the same time in the office. And I really try to be really respectful and understand what frame that they're coming from, really understand what their fears are, and really come from a place of humility, but respect of, again, no one's forced to do anything. But again, I want you to leave the door super well informed in whatever you're feeling. And in my own past experiences with my family member in the mental health system, I'm very cognizant of side effects. I really always want my families to leave empowered and to leave like they are the decision makers. And I always tell them, I'm here as someone to provide information so that you can make the best decision that makes the most sense for you or your loved one. I tell my family, but I feel like that's because of my background. And I feel like those are values that have been deeply ingrained in me in terms of humility and respect that I bring into the room. And I always invite kind of students to bring themselves into the room in terms of that presence, because it makes people feel more comfortable. They breathe. Sometimes they see me and they're just like, wow, eres Latina? And I'm like, yes, soy Latina. Hablo español también. I Spanish too. And for them, sometimes it's almost like they can breathe for the first time. And so it's a really beautiful feeling. And the other thing that I wanted to mention, kind of on a different side note, that amongst the hard times, one of the things that has been really helpful, and I always invite students and scholars to do, write what they hope to accomplish in terms of that mission, that vision. I call it, and other people call it like an elevator speech, so that they know where their guiding kind of direction is. And forever guiding direction is to encourage individuals to make psychiatry and the mental health field not so scary, and to really encourage the next generation to join me. So that's my elevator speech. And so I always tell students, keep that elevator speech kind of close to you so that it's guiding you in terms of the direction that you're hoping to accomplish. And it also helps kind of as you're struggling to remember, like, what is this mission that I'm here on this planet to do? What is the kind of vision? What is that goal or objective that I'm trying to reach at? I do that a lot, and I encourage students to do that and say, all right, next time that you tap me on my shoulder, you see me, say, Doctora, I've got my elevator speech. I'm like, I'm ready to hear it. And then the other thing that I wanted to mention really briefly is it took me a very long time to learn this lesson. And now I try to tell all the students and scholars that I come across this lesson is prove the people that are cheering you on, your tia, your tío, your abuelita, your significant other, your best friend, whoever those people are, that teacher, that mentor, all of that kind of this, whoever fills those stands, prove them right. I think a lot of times we focus on all the people that told us no, we're going to prove them wrong. But I feel like now as I've gotten older, I've realized, you know what? Let's prove the people that know what we're capable of, that see all that potential, greatest amount of faith, that are cheering us on when we can't cheer for ourselves, prove them right. And so that's kind of one thing that now I invite all students and scholars. I'm like, prove those people right. And the other thing too that you said, I was like, emotions. I'm a psychiatrist, so I'm all about emotions and validating emotions and saying, you know what, happy is good, sad is good, feeling all the feels is good. So definitely for this, I am 100%. Let's feel all the feels and have no shame in terms of feeling any of those feels.
Oh my gosh, thank you. You know, what you just shared with us, I will take with me too. I will do my elevator mission because we're constantly growing. We're constantly improving. We're constantly, finding out who we are. And you touched on so many things, Evita. The whole point of trying to fit in medical school, like you had certain things, but you weren't sure you could share other things. And I always felt that the reason for me was because I was already a minority. I was already a female. I always needed to put my best foot forward because I felt like I was speaking for all the Latinas. Like I always felt like I needed to present myself in a certain way because if I came across a certain way, if I was my genuine self, I may put some people off, may say things that they didn't agree with. And then, God forbid, other Latinas came in. They're just like Dr. Lourdes. So now that I'm older, I understand and I respect that it's so important to be true to yourself, true to who you are, to your culture, because I felt like I always tried to hide it in a way. Like, okay, if I don't stir the boat, then everything's going to be fine and I'll just check off the boxes and move on. But now that I'm here, I feel like, no, I can be myself. I'm still smart because being a physician is difficult work and it takes a lot, but I can be myself. I don't have to pretend to be somebody else. It's the way it is. I'm practicing medicine the way I want to. And then the other thing that really I'm going to walk away with this and that's opened my mind is prove those people right. Like I had always thought about, oh, you said no, let me show you, versus like, you said yes, let me prove it to you that you were correct. That is going to totally change the way I think about things. I feel like it's going to lift a lot of what I carry on my shoulders. I appreciate you talking about your background and how you've gotten here. And you have a lot of pearls. You have a lot of really great advice for those that need to hear this message.
Make sure to stay tuned for part 2 of my discussion with Dr. Evita Limon-Rocha because you will not want to miss it. Thank you for tuning in to the Becoming Latina Physicians podcast, your prescription for inspiration. Remember, your journey in medicine is not just about becoming a doctor. It's about the journey and the person you become while empowering others along the way. If you enjoyed this episode, be sure to subscribe at Spotify, Apple Podcast, or wherever you get your podcast. And remember to share this with others who need to hear this message. Until next time, keep shining bright. See you at our next appointment.